Good morning, everyone. This is Dr. Katie Woodley, the natural pet doctor. This is Coffee Talk with the Doc, and today we're going deep into kidneys and the urinary tract system with our pets. Have you ever had a pet that leaks urine? Like they get up and there's like a wet spot underneath them and there's all sorts of issues there. Like you're like, why is there a wet spot? Why is the bed wet? Why is the sofa wet? Why is the carpet wet? What's going on? So urinary incontinence is a really common condition, especially in our older pets. And there's a couple different reasons. So this is what we call the involuntary passage of urine when your pet's resting or when they're asleep. So it just leaks out. So what are some of these causes of urinary leakage? So there's, of course, numerous ones, right? So trauma to the central nervous system. There could be damage to the pudendal nerve, which innervates. So this nerve innervates the bladder, and it's going to help the function of the bladder. So if there's damage to the nerve, we're going to have issues with the way the bladder works. We also can have diseases of the bladder, the kidneys. Kidney disease can lead to urinary incontinence. Remember, their urine's not as concentrated. So that's very important. This could be a symptom of the underlying problem is actually kidney disease. So also other endocrine problems, diabetes, Cushing's, hypothyroidism, low thyroid can make your pets leak urine. So those are a couple of the issues. Bladder stones can lead to urinary incontinence, and then age related. So hormone imbalance, number one reason. But I want to say that never just go straight to hormone imbalance if you haven't ruled out the other things. So when I talk about hormone imbalance, you have, so really common in your spayed female dogs. So we're losing that estrogen and the testosterone influence to the external urinary sphincter muscle. This is the thing that keeps it shut, right? So as they get older and once they're spayed, they're neutered, we're losing that hormonal influence to that sphincter muscle. It relaxes, they leak urine. So that's a problem. And a lot of times what we do as vets is we go, oh yeah, you have an older female dog. She's been spayed. She doesn't have the hormones. She's going to leak, right? So they're like, yeah, let's just get her on hormone replacements. What happens if we do that and your pet has hypothyroidism? That's like, we just totally missed the reason, the root cause for this issue. So that's important. We need to make sure that we are ruling out these other underlying problems, doing blood work, doing a urinalysis. Do you see crystals in the urine? Do we see, an ultrasound of the bladder? Do we see kidney stones? Do we see bladder stones? We need to rule out the other things. And yes, it costs money, but it's going to save you a lot of money over the long run because you're going to actually treat the actual problem a lot more quickly than just putting them on a drug that has side effects, because we're talking about hormones. So these aren't like something that we just should say, yeah, it's fine. Like just put them on a hormone replacement. It can lead to all sorts of issues. So those are really important. The two most common drugs that we do reach for when we're treating conventionally. So Incurin, which is an estrogen replacement. So DES is the like shortened version. And what that drug has come off the market because of side effects leading to cancer potential, leading to diabetes, but it's back on the market. So works really well. However, there's those side effects that we talk about. And then also Proin. So that would be your PPA. So that's it's safer. So those are the drugs we use as hormone replacements if we're dealing with a hormone issue to help stop the urinary incontinence. I would say it works okay. Some dogs it works really well, and other dogs it does nothing. So definitely make sure you're ruling out underlying reasons. Find that cause, because we don't want to use these drugs that can have serious side effects for our pets long-term. Guess what? If we're treating the wrong thing and now we're giving a drug that has these potential side effects, you will spend money treating the side effects that are creating more problems for your pets in the long run. So that's really important. I love treating urinary incontinence with integrative medicine. It works so well. And most of the time we don't need to use those drugs. I don't use those drugs because what we're doing is we're looking at the plants that replace those. So there's some natural plants and herbs that are going to act like those drugs. Remember, most drugs come from plants and the way they work, but they don't have the synergistic properties of those plants to help balance them and make them safer. So that's why we tend to see more side effects with conventional drugs. So when we're using these plants, we're using the whole plant, we're getting that symbiotic, synergistic effect that I love. And we can use, there's a couple different plants. You'll see these in different products too. So VetriScience has another one that's really good for bladder. I think it's called bladder support. That's a great one. And you'll see things like corn silk in it. And then you'll also see our good old friend Romania that we mentioned when we talked about kidney disease. We also can use things like lemon balm and horsetail. The other supplements that I use a lot when we're treating urinary incontinence in our pets is glandular therapy. So Standard Process is a company that I love and use and have been using the products for years. And what we can do is whole food-based supplements, and they use glandular products. And we can use these products to help your pet's incontinence. Typically, I use this alongside, guess what? Nutrition. It's the foundation for health. So making sure your pet's on a food that's not creating inflammation in the body. And then using these herbs, these plants, alongside Standard Process supplements. And the last thing, that if you have a pet with incontinence, you need to do this with your pet. You need to find an acupuncturist. So a vet acupuncturist, someone who's trained in acupuncture, because the amazing power of acupuncture, and this is where it gets really cool. I love acupuncture. I just love integrative medicine. There's so many neat things that we can do to help our pets. With acupuncture, what we're doing is we're stimulating those nerves. We're awakening those back up. We're saying, hey, you should be functioning and you're not, so let's get you going. And we get the nerves talking to the central nervous system, talks to the brain. Everything's connected, right? And so we can start reawakening these nerves. We can reduce if there's inflammation. We can get the blood flow like moving again. We can stimulate certain points that are powerhouses for the kidneys, the urinary tract system, that are immune stimulants, support the immune system. There's all sorts of amazing things that happen with the placement of acupuncture needles. And most pets love it. That's the thing. Like, they love it. And so we need to stimulate that nerve function, stimulate that pudendal nerve, so that nerve that's innervating the bladder, to help with the contraction and that muscle function of that sphincter muscle. We need to improve that if we're truly dealing with like a hormone responsive incontinence. And the other thing that you can do, it's not something that I do, but I recommend it all the time for my patients, is chiropractic care. So chiropractic is going to help open up those pathways, get the nerves functioning if there's any potential inflammation surrounding that area. Or compression, that's where chiropractic care is really, really good at helping that. So that was a brief rundown of urinary incontinence, but I thought it's a nice play off of kidney disease because they can come together. And remember, kidney disease, it may show up as urinary incontinence. And urinary incontinence is so common in our pets and as they get older. So remember, if your pet, typically dogs, I don't see a lot of urinary incontinence in cats unless it's a male cat that has a urinary blockage, or a cat has bladder stones or has a urinary tract infection or a UTI. So we need to be ruling out these issues before we go straight to drugs and treat the wrong thing and potentially cause a whole other host of issues. But keep in mind, we do this every Saturday. We talk about different health conditions with your dogs and cats, but what we do is we talk about the integrative care. and the things that you can do, because I know you're here because you want the best thing for your pet. And I love that. And that's why I love doing what I do, partnering with amazing pet parents like you guys. So check out thenaturalpetdoctor.com for more information. We have a lot of blog posts. We're adding them every week, multiple ones. We have a YouTube channel, The Natural Pet Doctor. Make sure you subscribe to that. Register for our webinars. And if you want more, and you want more of this with a like-minded pet parent community, check out our Natural Pet Tribe membership. Every month we go deep. We go deep into all of their questions. So I take all the questions you ask me and we turn it into content so that it can benefit everyone. And if you need more personalized care, we do consultations, we do telehealth, we do in-person consultations if you're in the Northern Colorado region. So reach out. I'd love to help you guys. Check us out, thenaturalpetdoctor.com. Check out our membership. I'd love to see you there. We do the live Q&As. And one of our memberships also has a 60-minute Q&A with me once a month. So that's pretty dang exciting. You can ask me whatever you want and we go deep. So definitely check it out. I'd love to see you guys there. I'm not seeing any other questions. So thanks for joining in. I appreciate you coming every Saturday morning, 10 a.m. Mountain Standard Time. You can always use the hashtag #AskDrKatie with any of your questions. We'll make sure we cover those in our weekly talks, Coffee Talk with the Doc. So thanks again. I'm Dr. Katie Woodley, the Natural Pet Doctor. Have an amazing weekend. And thank you, Sue, for that. And I appreciate everything that you do for your pets. All right, take care.